I'm Lucy Beednell with the ARC of Northern Virginia. In this 3-minute webinar, we'll look at what it means for someone with a developmental disability to find housing, support services, and a good life and make them marry all together. Because really, when we talk about having people be successfully housed, that doesn't just mean you have a place to lay your head at night. It means you've got the support you need around you to be successful and all the other fun things in and outside of your home that make life great. Traditionally speaking, housing for people with developmental disabilities was offered through the Medicaid waiver system in either a group home where a number of unrelated people, usually 5 to 6, lived together and staff came in and out of the home on shifts 24 hours a day, independent living services where someone with a disability has drop-in staff, sponsored residential services where a caregiver has someone with a developmental disability move into their home, or supported living, where someone or multiple people with developmental disabilities live in a home and a support provider brings in staff. In these options, housing and support services are linked. You can't change one without changing the other. And generally, roommates were chosen for you if there were to be roommates, and there were in most cases. It didn't offer a whole lot of choice as services were so tightly bundled. Since our settlement agreement with the Department of Justice in Virginia, we're moving towards options that are a bit more flexible, where you can choose a way to fund affordable housing, bring in the supports that you want in the quantity that you want, and choose your particular roommates, if you want any at all. This is being done commonly through the State Rental Assistance Program, or SRAP, that works like a traditional housing voucher. In these programs, the person with a disability pays 30% of their adjusted income toward rent, and the voucher covers the rest. This works similar to a model of public housing where some localities own housing that they rent at similar rates to people with disabilities. Arlington specifically has a housing grant that operates in a similar fashion. Other people who don't have access to those programs have rented a room in a house, which tends to be more cost effective than renting a whole apartment to yourself. And there's a new Medicaid waiver service as of 2018 called Shared Living, where the person with a disability lives with a roommate without a disability in mostly a peer mentoring and partnership sort of relationship. But in all of these situations, the person with a disability chooses their particular housing and how to fund it, the particular supports and type that they need, and any roommates they want. How do we fund those support services since now things aren't bundled? Well, once you have the affordable housing piece in place, you look at the supports you need. A lot of people are funding these programs with DD waivers, the Commonwealth Coordinated Care Plus waiver. Those are both Medicaid programs offering services in your home and community. For people between 18 and the day before they turn 21, there's an EPSDT program under Medicaid that funds additional supports, and we've got videos on that. Natural supports like family and friends, private pay options, or leveraging your housing assistance for a free live-in aide who's paid for by receiving free rent. On top of that, of course, you want to add the other things that make life great: relationships with family and friends, recreation and social activities, relationships with community members, work, and volunteering. To learn more, visit thearcofnova.org or ask us a question anytime at thearcofnova.org/answers, and check out our Transition Points Toolkit, including that on finding a home. Thanks for joining us.